One of the first things that I heard about Lewy body dementia was that it was a dementia with cognitive fluctuations, fluctuating cognition. What I realized once I got into the journey myself as a Lewy body dementia caregiver for my husband John was that it was a fluctuating dementia, not only for cognitive symptoms, but also for the autonomic symptoms, the behavior mood symptoms, the movement symptoms, and the sleep symptoms as well that come along as part of the 5 moving parts of Lewy body dementia. I talk about these 5 moving parts in another YouTube video called The 5 Moving Parts of Lewy body dementia. So if you'd like to look at that and learn a little more, that might help you understand what I'm talking about. But what I decided to do early on that I hope may help you as well was I wanted to use these fluctuations to my advantage. Because something was happening today doesn't mean that it's going to happen tomorrow. Doesn't mean it's going to happen even later on today. Because things with Lewy body dementia can change minute to minute, day to day, week to week, year to year. And things that can present as very severe early on in the disease sometimes can disappear and maybe never even come back with certain patients. With other people, they may come back, but with a different level of intensity. So this is a dementia of fluctuation. And I'm going to talk about how I use that to my advantage as an LBD caregiver. So whenever something like this happens, where you have a fluctuation occurring or something negative occurring, one of the things I would ask myself was, what just happened to trigger this? Was it something in medication? Has a new medication been added? Was something taken away? Did we do more than one thing at a time? Various things with medication quite frequently can trigger it. If there is a surgery, you have a very intense possibility that there are going to be some significant fluctuations depending on what medications are used pre-surgery, during the part of the surgery where you need anesthesia, and then post-surgery. So things like can be triggered there. Did something happen in the environment that's different? And it can be as simple as the light in the room, the temperature in the room, the emotional atmosphere in the room, the sound or sounds in the room that may be triggering something. Just becoming aware of what was actually going on was very, very important. I call that being very perceptive as a caregiver to what's going on and looking for triggers if something's happening that seems a little unusual or negative. Could it be personal interaction? When certain individuals come in the room or when I would come in the room, what is the tone in my voice, the look on my face, what is my body language sending out as a message to John? Maybe it's what I'm saying, is it processing, or maybe it's simply how I'm saying it, the words I'm using, or the tone of voice that I'm using. Things like this that occur with personal interaction are huge with any dementia patient, and certainly the case with Lewy body dementia patients. Or it could simply be Lewy body dementia itself, manifesting itself. And that, just knowing that whatever is occurring doesn't have to be a permanent thing. And just because it's happening now doesn't mean I'm going to have to deal with this particular thing forever and ever, every single day going forward. So just knowing that, being aware that this fluctuates, can frustrate you in the sense of you can have this false illusion that, oh, things are all better today. Are we sure this diagnosis is right? Maybe we were wrong about this. Maybe he doesn't even have dementia. So this false security can kick in, and then when the symptoms come back again, people tend to crash. So I want to warn you that that is a pitfall that many dementia LBD caregivers fall into. Try to avoid that pitfall and understand that fluctuation is the name of the game in Lewy body dementia. And so how can that be of benefit? Well, let's look at some ways that may play out and how I try to use those things and see them as a benefit. Knowledge is power, hugely. Knowledge is power in Lewy body dementia caregiving. So let's go through the 5 moving parts. The first one, the autonomic symptoms. For my husband, blood pressure and constipation were 2 things that showed up. With blood pressure, early on for 6 months, his blood pressure was all over the map every day. It just went haywire. At that point in time, it was likely, looking back, just the disease beginning to really present itself and waving flags that, hey, Louis has come to town. I just didn't know it yet. And so that was pre-diagnosis for John. But later on, he had blood pressure issues in terms of orthostatic hypotension, which is a fancy way of saying when somebody is going from sitting or lying down to standing up, their blood pressure drops too quickly. They get dizzy. They may feel faint. I realized this is happening way too often. That can just be what's going on with the disease. But I was looking around to see, is there another trigger? The trigger for John was that he had added Sinemet or carbidopa-levodopa for his movement symptoms, and he was already taking blood pressure medication, and he was taking that well before this diagnosis of LBD came up. And so both of those things, I had learned from another caregiver that Sinemet would lower, a side effect was it can lower blood pressure. So his blood pressure medication was lowering his blood pressure. His Sinemet, coming into the scene now, a new player, was lowering it. So we had a decision to make and had conversations with the doctors, and the blood pressure medication was taken away, and the problem pretty much disappeared because Sinemet was now not only handling some movement issues, it was doing double duty and lowering his blood pressure that needed to be lowered a bit. So things like that, being aware of that kind of thing, and knowing that the fluctuation can be part of the disease, but it can also be something that you might be able to manage, was helpful. With the constipation issue, the biggest change there was it was one of the first symptoms that John had way years before we had a diagnosis of LBD. But he also had trouble taking in water. He just didn't like to drink a lot of water and didn't hydrate enough. And every time we'd have to go to the ER with constipation, the #1 recommendation was drink more water. And so just being aware that constipation, digestive issues may come with the Lewy body diagnosis for many people. And just by hydrating more, you may be able to take care of that without bringing in any other kind of medication. We eventually added Miralax because it was a more gentle way. We included, of course, more fruit. We put prunes. You know, there's classic things that you can find online. And people have found some other good solutions. And so learning these things and learning they are part of the disease, but you can manage them, and you can sometimes manage them without medication. That's an example of is kind of turning to your advantage, not being thrown by this, but kind of getting ahead of it and thinking ahead of time. Behavioral and mood symptoms of Lewy body dementia tend to bother people. Some of the most intense issues come up in this category. Here again, it's very important with all these fluctuations to do 2 things. One, accept that they are part of the story. You just have to accept it. And then adapt. Adapt to this. Be aware of this. Become very perceptive and very persistent in looking around to see what might be triggering. For instance, for behavior, is there something that is triggering that behavior? Is there something in the room, a child coming in the room and talking a lot, and the person with LBD, the grandparent who's normally loving, can't process, and so they become very agitated when the child comes in the room, and learning how to get around that. And one of the things we did with that situation was I also talk about this in another video. We personified Louis, and we just said to the grandchildren, okay, this is Louis talking to you when Pops is mad. And when that happens, leave the room and come and see me, and let's talk about it. And we take a little break, and then you go back in and be cheerful, and I'll bet you your Pops is going to be in a much better mood. That frequently happened, and the children embraced this, that this was Louis talking to them being mean. When Pops was nice, he was being Pops. When he was not so nice, that was mean old Louis, and you just get out of there and leave Louis alone, and your loving Pops will be back. Learning how to turn those situations and adapt them can make a big difference. Learning about reset time, knowing that these things are going to come and go, that's a benefit. They don't necessarily come and stay. And so if there is negative behavior, aggressive kinds of things, learning to meet your loved one in the emotion that's behind that, that may be fear, frustration, worry, there may be physical pain, something that's working on their mind, but it comes out as anger. It comes out as a very negative emotion. And learning to speak to that underlying emotion that's behind. Learning just to say, I'm sorry. Even when they say something or accuse you of something you haven't done. Oh, that must feel terrible to feel like that. Oh, I am so sorry. And then exit the room as quickly as you can, as gently as you can. Take some deep breaths. You reset, let them reset, and then re-enter the room. With a cheerful look on your face, relaxed body language, pretend you're an actress and you're going to win the Academy Award on this one, and you're just not going to let Louis throw you for a loop. And if they come at you again, you just exit again gracefully and give them more time. So learning how to not be thrown by those things, to say, oh, that's Louis acting up again, I got to outsmart him. And that's the kind of stuff that I had to do at my house to minimize the damage that Louis was doing. The worst thing you can do is argue. When they're wrong about something, when they're confused about something, when they can't put their clothes on right, saying to them, why can't you do this? You could do this before. Doesn't help. You really do have to get over yourself, your need to be right. You have to get over your need for them to be right and accurate in everything, and just meet them where they are. Remember, Lewy body dementia, any form of dementia, is brain failure. It's the brain not being successful in doing what it could normally do. So the person who's contending with that in their own body cannot help it. It's not their fault. You are the only person in that room, if there are two of you there, who can fix that. You're the only one who can do something to try and make that better. They can't. Even if they were a bit of a jerk before, and granted some of them are, and we've all had our moments, haven't we? That doesn't mean, and don't act like they're being that jerk again. Assume the best. Assume they're trying, but they just can't. Remember, you want to outsmart Louie, and you want to love and nurture your loved one. So adapting, accepting, learning to turn these fluctuations, and remembering just because they're doing it now doesn't mean they're going to do it a few minutes from now or later on today. Or if it does last all day, it may not be happening tomorrow. Lean on that reassurance of what you know for sure about Lewy body dementia. And what we know for sure is that it fluctuates. It changes. That means the bad stuff doesn't have to be in the room all the time. And you can manage it, and you can often usher that bad stuff out by a smart choice that you're making and not taking this personally. Now, the cognitive stuff that can come up, and all kinds of stuff, if you can remember that just because it's happening today doesn't mean it's going to happen tomorrow. Just because it's happening right now doesn't mean it's going to happen an hour from now. I would say to John oftentimes, John, this is Louie messing with you right now. If I could tell that he was at a place where he was likely to be able to receive that from me, I would say, John, Louie's messing with your brain right now. If you'll just close your eyes, take a break, just relax for a minute, maybe take a nap, I think you'll wake up and everything will be okay. I think you're going to feel better. This is Louis messing with you. And I did say to him early on, and I used this over and over again, John, please let me be your second brain. I'm not going anywhere. I'm with you throughout this whole journey, honey. And if you will just lean on me, and when things are going a little haywire, and you're feeling bad in some way, I'm going to be your second brain. And I would remind him of this. I would say, John, let me be your second brain right now. Louie's messing with you. And then he would often relax into that and let me do that. Not going to happen every time. Once or twice he said to me, second brain. But it didn't happen much. And so it's worth trying. It's worth trying, especially if you're early in the journey. Establishing that as a foundational thing and reminding them of that may help you later on in the journey. In terms of the movement symptoms, the key there is to get as many tools in your house as you can as early as possible. Remembering that learn the Medicare rules. For instance, if you have to choose between getting a transport chair and a wheelchair, figure out which one's going to be more expensive for you, or if you can get one of them at a resale store somewhere, a consignment shop, and then use the Medicare ticket for the other one. Learning rules like that, getting ahead of the game, getting those things in your house before you need them. Get a shower chair if you don't already have a bench in your bathroom in the shower area. Get that in early so that the first time it's needed, it's already at your house. Those kinds of things made a huge difference for me. We had a basement, and pretty soon I had all kinds of equipment in that basement long before John needed it, and most of it was either donated, given to me, or I had bought it at a dirt cheap price somewhere at a consignment shop. And I learned which times, for instance, like with hospital beds and things like that, you do have to have an actual doctor's appointment and in order to get that prescription so that it's paid for by Medicare. Those kinds of things, just learning those rules of the road, talking to other caregivers, going online, listening to videos like this, learning those tips can make a huge difference to using these fluctuations. And also, just because something happens one time, like a movement issue where a shower chair might be needed, I think we used that shower chair, once or twice, goodness, a few months after I got it. And it was quite a while before we needed it again. And so these things are going to come and go, but having what you need ahead of time makes all the difference in terms of your ability to stay calmer, to feel like you're a little more in charge of this thing that can make you feel quite out of control unless you can take some of these steps. The sleep issue, REM sleep behavior disorder, where they act out dreams, this kind of thing, learning to get ahead of that by learning about proper treatment and the latest information by the person who discovered it, Dr. Carlos Schenck, says in his latest paper, 6 milligrams up to 18 milligrams of melatonin is the first line of treatment. You have to start low, titrate up very, very slowly. Always work with your doctor, but let your doctor know melatonin is now the first line of treatment by the world's expert in REM sleep behavior disorder. Adding in clonazepam or Klonopin at the lowest possible dose if you need it. As a supplement to the melatonin. And that is the opposite of what the recommendation used to be. But I do want to make sure you do know that. Other sleep issues are things like sleeping a lot during the day, getting up a lot at night. The way I handle that at my house, everybody's going to do it differently. Different doctors are going to recommend different things. But I basically let him sleep because that's when his brain was cleaning itself out. And I took my naps as much as I could when he took his. So if he slept a lot during the day, I would take naps sometimes too, and then get other things done when he was sleeping. And that way, if we had to get up at night, it was easier. It is important, however, I think this lack of sleep can do you in very, very quickly as a caregiver. So it's important for you, when that starts happening at your house, being awake a lot at night, get someone in as quickly as you can so that you get good rest. That's for your safety and for good quality caregiving for your loved one. The last thing I want to say about fluctuations is the best one. Because they fluctuate, in their memory, their cognition, all these different areas. One of the things that may come and go at times is recognizing actually who you are. But remember, almost all of them know who you are at the end of this disease. They know their loved ones, almost always. Isn't that wonderful to know that? It was a blessing to me. On John's last day on this earth, he not only recognized me, he told me how very much he loved me. Oh, that is wonderful, wonderful memory to have. I hope you have a good day. I hope this has helped you think about turning those fluctuations of Lewy body dementia on their head a little bit and giving you a little more of a handle on some caregiver tips. Take care.